A few years back, I read an article about probiotics, but it was specifically about something that was being called smart biotics. The development of these good, healthy bacteria in different combinations, boring down to the genus, species, and even the strain, and then again in different combinations to be more specific about what we're treating. And I think we've seen enough of that we really need to talk about smart biotics, and one in particular which we'll end with. So what do I mean by smart biotics? A smart biotic is something that's specific. So this is a specific ultraflora women's probiotic. So the bacteria in there are specific for women, and a lot of times it's specific for women's genital health. That's really what they're targeting. Here's another ultrabiotic woman's formula. Now, the bacterias in here, they're different culture forming units and they're different bacteria, but the research that's done is this combination, when put together properly, does a really, really nice job of targeting that. Here's a smart biotic it's an immune booster. So the bacteria in there, and probiotics are typically good for your immune function, but the combination of the two types of lactobacillus and the specific strains that are in here are specifically used to boost your immune function. And you'll see some immune function probiotics that include things like colostrum, because that's good for your immune function. This is really just good bacteria to boost your immune function. Interesting probiotic is one called Akkermansia. Akkermansia is a very unique combination of probiotics that really helps support weight management and glucose metabolism. So if you're struggling with some blood sugar issues or on a medication for blood glucose and you really want to boost the ability, Akkermansia is a really good probiotic for that. And with all of the weight loss medication being used these days, here's a couple that are specific for that. This is actually called a GLP-1 probiotic. So again, it helps metabolism, it helps the glucose receptors so that you can really control that, which is really, really part of your ability to control your diet and lose weight. The GLP-1s tend to cause some GI issues, so it's specific to try to fend that off to a certain degree. And then this metabolic daily really helps increase your metabolism. So if you're a thyroid patient and you're having some weight problems and you're using a GLP-1, something like a metabolic daily would be a really, really good choice. And then we're going to talk about something that's very, very new. I find it super interesting. And I think there's a real audience for this. It's a probiotic called Skinessa. It's a combination of 5 different bacterias all the way down to the strain that the combination is showing, and real good evidence being used to treat specific skin conditions: eczema, seborrhea, psoriasis, skin infections. People typically go to the doctor, they get a steroid cream, they may even get an antibiotic for a skin condition. It might get better, but it tends to come back. This is a great thing. I think that's something you can try. When I talk about the evidence, there's some real good visual evidence from the use of Skinessa and treating some of the skin conditions. And if you're interested, this is on our shelf for you to review. The thing that I find super interesting about the theory of taking a probiotic for a skin condition goes back to yin and yang. So the two biggest organs in our body are our skin and the inside of our GI tract. And if you think about the inside of your GI tract, it's really like a second skin, because it's external for the most part. You know, it's in our mouth, and then it gets to our it ends at our rectum, and in between are these feet, many feet of intestines and colon and stomach and esophagus, but it really is almost an external organ. Our skin is an external organ. So the yin and yang theory, which is more of a Eastern medicine theory, is the idea with skin and GI tract is when you have a skin condition, we oftentimes tell patients, you know, you should probably do something for your GI tract. And probiotics would be part of that recommendation, because what's going on the outside may very well be going on the inside. So if you have dry, patch, psoriatic skin, inflamed, the inside of your GI tract could very well be the same. That's your yin and yang. Now we have a specific probiotic called Skinessa that's targeting conditions of the skin. And the interesting thing to me is if you're dealing with a skin condition, you may very well have that same thing going on the inside. So using something like Skinessa, and especially if it works for your skin, just imagine how much benefit you might be getting for the inside of your GI tract. Very easy to take. It's one a day. This one does not require refrigeration. The webinar that I listened to from the experts and the developers talked about patients, because you may have a skin condition that you've been dealing with for sometimes years, and they say at a minimum it takes at least 2 months to see any results, and sometimes 3 or even 4 months. So you have to be patient with it. A container is a 30-day supply, so you'd want to make sure that you take it for a period of time to give it a good chance to work. So again, Skinessa, a probiotic specifically for skin conditions, with really, really good track record of some of the conditions that it's being used to treat. And if you have questions, obviously stop by or give us a call, because you may have some skin in the game. Skinessa.